There is a narrative that we have grown accustomed to in America to believe that incarceration is a legal issue, that it begins either in adolescence or adulthood when an individual makes a wrong decision. But as I've been reflecting about this and reading different studies, I feel like this is actually a much deeper issue, a deeper rooted issue that I don't really see this discussed much. Research published in May of 2020 found that over 6.5 million Americans were under some form of correctional supervision in 2016. So it was 1 out of every 100 adults. We know that incarceration in America is deeply tied into poverty, lack of education, social and behavioral conditions, but we've seen quite a dramatic rise in incarceration rates between 1973 and 2009. Some can say that these are from policy shifts, housing instability, mental health, substance use, poverty. But what's also telling is how unevenly distributed the numbers are, mainly between Black and Hispanic men, particularly those with lower levels of education. Black men with low education levels are at a higher risk for incarceration. We also know that Black children are more likely to see their parents go to prison compared to white children. Those numbers, according to this research, is 1 in every 9 compared to 1 in 57 white children. Now, this is where my mind is spinning, obviously, because it's not just about the individuals that are going to prison. It's about the families. It's about the other people that are involved. It's about the homes and what gets passed down generationally, right? There are studies showing that Black children are disproportionately suspended in school. One study showing that 18% of Black children make up preschool enrollment, yet they account for 48% of suspension rates. This doesn't beg the question of what did a preschooler do? We also can take into account dyslexia and ADHD, other learning disabilities that could be kind of attached to this issue, but I'm not really going to focus on that so much in this video. Where my mind kind of goes, because I work with a lot of families that have children with behavioral or learning disabilities, is what is that child carrying? What are they seeing at home? What is kind of being passed down in the nervous system patterns of the parents or their caregivers? Dysregulation, nervous system dysregulation, mineral imbalances, metal toxicities, mold, Lyme disease, parasites. Are these children that are getting suspended from preschool, very early age to be getting suspended from? Anybody can agree with that. Are they inheriting stress patterns from their parents or caregivers and modeling or mirroring that from the environment that they are in? We know that a lot of children feel misunderstood, especially if you are a parent of a child with dyslexia or autism or ADHD. You know that these kids feel very misunderstood. They feel very frustrated. A lot of times they are met with punishment and not support. And so these are where issues do not just disappear. Sometimes you can't punish the bad out of them. It escalates. This is where we can see those patterns continue on within a family unit. Now, what I find interesting is I was recently reading a study that was conducted in Clay County, Kentucky, which discusses a dynamic of which young adults in economically constrained rural communities often experience an increased transition into adulthood or family roles, such as becoming a mother at a very young age, in their teens, in their early 20s. They discuss that there are big 5 markers of adulthood, which is leaving home, finishing school, finding work, getting married, and having children. Now, a majority of the lower income individuals in Appalachia typically jump 2 to 3 spots ahead. So they're usually not leaving home, not finishing school, and then sometimes not finding work. They are either getting married or having children out of wedlock. Is that you don't really know who you are. You don't really have an identity of the self, a sense of self, or that foundation within yourself. And this is where that vulnerability can kind of come in, and those nervous system patterns get passed down. Resources are very limited in these areas. Many people are entering in adulthood quicker than they should. They don't know how to regulate their nervous system. They have not been properly taught to nourish their bodies, hydrate, how to establish boundaries in various settings of their life, and then how to build a stable internal foundation. And so they do what they have always seen being done, which is form relationships, create a family, raise children, but not always from a place of fullness, from a place of depletion, lack of capacity. And again, this is not because they don't care, but this is just what the research is showing, that this is all they've ever known. Again, very limited resources in these areas. So without intervention, without resources, those patterns continue from one generation to the next. And so the question then becomes, when are we going to stop waiting, or are we going to wait until something breaks? And we are already seeing this with the school to prison pipeline, the incarceration data, kind of to tie all of this back together. Many people will intervene whenever there is a crisis, rather than starting at the root, at the level of the home, the foundation of the self, the woman, and then the marriage, the nervous system, before we become mothers, before we take that step into adulthood. The foundation of a family is not built when the child arrives. And I think that is something that we don't really understand within our society. And this is something that even other cultures across the world kind of discuss this, and we have ancient texts to back this up, that they don't just prepare for a child when they decide that they want to get pregnant in the next month. It's built long before that. So all of that to say this, a lot of these foundational tools start within the home. I believe if we are able to reach more women and provide access to these foundational tools and resources to support women, and then of course the men, the family unit, yada yada yada, would that also support a decrease in incarceration and reincarceration rates, because we are starting in the home.